Just 1 minute. Okay, Caroline, you're all set.
Okay, great. Thank you.
You're welcome.
Okay, so welcome to everyone who is here in attendance. I'm just going to take a minute and introduce the panelists that we have with us this evening. We have Laura, our superintendent of schools. We have Brian Freed, our assistant superintendent for business, finance, and operations. We also have Maureen Walker-Sipe, who is one of our district nurses, and Cheryl Sprague, our district clerk, is here as well. So thank you to those of us who are able to be here this evening. We really appreciate your attendance. We hope that we'll answer many of your questions. However, if we don't get to a question, we will also be publishing an FAQ after this meeting for anything that comes up in the Q&A function of tonight's webinar. So using that Q&A function, if you wouldn't mind, please just write your name so that we're able to make sure that we answer your question fully. If we have any questions clarifying questions as to what it is that you're asking specifically, we may be in touch prior to putting that out there on the FAQ. So I'm going to go ahead and share my screen, and we will be getting started. Just so you are aware, this will also be recorded. We are currently out on YouTube for the live stream, but it will also be recorded so you can refer back to it later. Okay, so as you well know, this evening is in response to many new cases of COVID-19 within our school community. So tonight's Q&A is targeted at answering some questions and providing additional information regarding the status of the district with regards to COVID-19 infection. Facts of the current status of the district: we currently have 16 confirmed cases of COVID-19 concentrated at our high school. In addition to that, we have 2 presumptive positive cases as well. All of those cases are in students. We have 0 cases currently in our staff members. We're currently tracing multiple origins of infection leading to these cases. So some of the questions that came in did look as though there was a lean towards believing that these were all athletic related cases, and that is simply not true. There are multiple origins of infection leading to these cases at this time. So positive results are not related to asymptomatic surveillance testing. For those of you who participated in our last board meeting, that was a topic of conversation. However, the surveillance testing was due to begin on March 1st, and we were on remote learning because of contact tracing efforts that were going on. So all of the contacts have been contacted as of this morning's cases. Throughout the day, there were 3 additional confirmed positives. They are included in that 16, so this is not over and above that. But within that, there are 3 cases that we became aware of today. So the contact tracing efforts and the reports to DCBH happens today, and there may be additional contact tracing that has gone on today. But as of this morning, we were up to date. We are currently closed for remote learning in our secondary schools until March 11th, and that's in an effort to stop the spread of the infection. And something for you to note, Millbrook Central School District only contact traces within our 4 walls. So for those infections that might be related to outside organizations or spread within the community, we do report any knowledge we have or information related to any others that are potentially affected, but we may not be performing that contact tracing and the actual contacts of those persons. That would be left to the Department of Community and Behavioral Health, as well as those outside organizations, to be doing some of that contact tracing. I just wanted to make you aware of some of the parameters of this Q&A. We will address the facts of these cases. We will also address some best practices for COVID requirements and provide some information about returning to school post-COVID infection. What we will not be able to do is we will not be able to address any questions that are based on hearsay. We will also not be able to address any questions related to the efficacy of vaccinations or their side effects. We did receive some questions about that, but that's not what this is about this evening. We will not be able to answer any questions directed to the Board of Education. We simply don't have the authority to do that. And we will not answer any questions regarding recommendations for the expansion of in-person instruction, but there will be a discussion and presentation regarding that at the next board meeting on March 9th. We will also not be able to violate HIPAA or FERPA and divulge any additional identifying information. So here are some of the questions that we received from the community today, and some of the answers that go along with it will be provided by our panelists. Were the positives a result of the mandatory testing of athletes or random testing of students? As mentioned, we did have a two-phase plan for the mandatory testing of athletes, and subsequently in phase two, not mandatory, but the testing of surveillance testing of asymptomatic persons in our school community. That was inclusive of students and staff. That was phase two. Millbrook Central School District is currently taking precautions for the safety of our athletes. Do we know if other teams are doing the same? There's no standard testing protocol right now. Some schools are testing their athletes, some are not. Like I said, there is no standard, but the testing of athletes is supported by the Dutchess County Department of Community and Behavioral Health. As mentioned previously for this third question here, there are plans to be able to provide asymptomatic surveillance testing for students and staff. However, we weren't able to begin phase one of this testing plan on March 1st, which was intended to begin with our athletes, specifically because of their participation in high-risk sports. And therefore, we would be able to start phase two once we are able to be back in person. Unfortunately, due to the contact tracing related to these current cases, we were not able to start with that testing program. Did all of those affected as contacts of a case receive a contact tracing call? And did you notify the other school districts that Millbrook played in the days leading up to the first positive case? So we had been able to trace, as I had mentioned, up until this morning, and there's still contact tracing that is going on. However, as of this morning, we had been up to date in contacting all of the Millbrook Central School District contacts of those cases. As mentioned previously, any of those cases that are related to outside organizations, they may be followed up with by a member of DCBH contact tracing. What is the total number of positive cases of students and staff, and does the district currently have, and how many have been asked to quarantine? So as I mentioned, we currently have 16 confirmed positive cases at the high school. We also have, in addition to that, 2 presumptive positives. So we'll explain this a little further in a moment, but what a presumptive positive is, if you are a confirmed contact of a positive case and you yourself become symptomatic but choose not to test, we have to presume that you are positive as well. If you are symptomatic and again, a contact of a confirmed case of COVID-19 and refuse to test, we have to assume for tracing purposes that you also are what's called a presumptive or presumed positive. When we're saying how many do we have that are currently asked to quarantine, it's very difficult to land on an exact number for that. As mentioned, we do our tracing internally. However, if any of these cases are related, which some of them are, to outside organizations or familial spread, we're unable to provide information that is tracked by the contact tracers from DCBH. So to give you an exact number right now would be faulty. According to the February 22nd, 2021 memo from Dutchess County Department of Community and Behavioral Health, Millbrook Central School District is in the low rating for new cases per 100,000 and percent positive tests. The memo does not call for suspending in-person learning or sports programs. What is the measure you are using for your action, and what measure are you using to rescind the arbitrary date of March 11? So just to be clear, every decision that has been made by the district in response to these cases has been in conjunction with DCBH. These decisions are not made solely by the district staff, and 3/11, that date is actually not an arbitrary date, but it was landed on based on the quarantine period for those initial cases. As our numbers continue to rise, even as recently as today, we'll be continuously reassessing and be in touch with Dutchess County and the Department of Community and Behavioral Health to make any decisions on when it is safe to return to school. As it can take 10 to 14 days for contacts to become symptomatic, we are waiting to see if additional students become symptomatic from the exposure in the recent past. In order to answer some further questions, I'm going to ask Maureen if she would mind just explaining isolation and quarantine, as they are different but often used interchangeably.
Okay, so since we've been living with these new vocabulary words, if you will, for almost a year, oftentimes in the community, we interchange quarantine and isolation, but they're used very specifically in health-related conversations. So if any of your students or yourselves were put into a quarantine, what that is a separation, a period of separation for an individual who has been deemed a close contact. And what makes you a close contact is that you were standing within 6 feet for either 10 minutes consecutively or 15 minutes in combination at an outing, right? So within 6 feet for 10 minutes consecutively, 15 minutes cumulatively to a person who has tested positive. So if you've been within 6 feet for that amount of time, mask or no mask, with a person who is a known positive, then you are asked to quarantine. So when you quarantine, this means that you should be separated from the other members of your household. And a quarantine individual is required to stay in separate quarters, eat separately from the others in the household. And if complete separation of the quarantined individual and the rest of the household members is not attainable, then the household members join the quarantined person in the quarantine. Isolation is separate from a quarantine because the isolation is for the person who is positive. So if you test positive with COVID-19, then you will be in an isolation. The isolation can be in your household. If you are to stay in separate quarters, again, from other household members, you are to use a separate bathroom from others if that is possible. Meals are not to be shared within the household, and they're to be delivered to the individual in their isolation space. So if you are a known positive, you go into an isolation. If you have been within 6 feet for 10 minutes consecutively, 15 combined, mask or no mask, then you are deemed into a quarantine. And if you are a contact of a contact, then you are able to continue about your daily routine. So those are the 3 steps. If you're positive, you're in isolation. If you're a contact, you're in quarantine. And if you're the contact of a contact, then you're free to live your daily routine.
Thank you, Maureen. So why this information becomes really important is when we notify folks of either their need to isolate or to be in quarantine, we sort of think of it as an A, B, and a C. So the A, that person is our positive case. If B, that person who was a contact of a case, becomes symptomatic, they would then need to go into isolation, and their original contacts that we referred to as a contact of a contact before, they then become a contact of a case. And the case is this now B symptomatic person. So this question was, if my student in quarantine becomes symptomatic and tests positive, what does that mean for the rest of my household? So initially, if your student in quarantine, we know that they were in quarantine because they were a contact of a case. So that was the original B group. If those folks become symptomatic, they become a new case, and their contacts who were previously referred to as a contact of a contact now become a contact of a case, and they themselves would need to quarantine. So what do I do if my child who has not been affected by this outbreak to this point becomes symptomatic? So you're going to do a couple of things. One, if your child becomes symptomatic, you're going to want to contact their healthcare provider, and you're also going to want to be in touch with the school nurse. So that's information that we're going to need to know. If your child has already been ordered to quarantine because they were a contact of a known positive, remember, that may put them in the group that is now a case themselves. Being a symptomatic contact of a case means that you are a case yourself. You will need to contact your healthcare provider, and your case would need to be contact traced. So we would need that information here at school as well. So anytime while COVID-19 is a factor for us, that your child becomes symptomatic, it's going to be really important for you to be in contact with your school nurse and your healthcare provider. Maureen, can you talk a little bit about what the requirements are to return to school after a mandatory quarantine or mandatory isolation?
Sure. So if you have a student who has tested positive and they were in isolation, their isolation should be 10 days. And after 10 complete days, your child needs to, in order to return to school, they need to have symptoms improving, and your child needs to be fever-free without use of fever-reducing medications for 72 hours. So fever-free for 72 hours, child has symptoms that are resolving, and you've fully completed all 10 days. That is how you return to school if you were in isolation because you were a known positive case. You are required to go onto the Dutchess County website, which your nurse will absolutely share the link with you and assist you in any of this process, to request a release from isolation letter, which will come to you directly from the Department of Health, and then you will return to school with that letter as well. If you are in a quarantine, and if you're in a quarantine, you do not need to have any negative testing in order to return to school. Have any other questions on that one? Oh, you're on mute.
So if my child was in isolation because they were a known positive, and I was unable to create separation in my household that is safe for quarantine purposes, and I myself became symptomatic, when would be the first day of that 10 days? I become symptomatic today. When would we start counting those 10 days?
So your first day starts one complete day after your symptoms. So your day 0 is when you become symptomatic, and then you start counting day 1 the next day. Okay. And your school nurses will definitely help you count out your days. And if you have multiple people in your household where one is a known positive and the other is in quarantine, maybe, well, multiple people in reference to work as well, but students in separate schools within the district, your school nurses will help you shift those days. If one is in isolation and the other child's in quarantine because of the isolation, they may not have a release on the same day. So please contact your individual nurses, because they're well-versed in it and they'll help you understand it further.
Right. So again, if my onset of symptoms was today, today would actually be day 0 and tomorrow would be day 1.
Yes.
Thank you.
I'd like to state one more thing. If there is a student who has received a positive COVID-19 diagnosis, that student will require a clearance note from his or her primary care physician in order to return to play for physical education and athletics.
Great. Thank you very much. And that has to be from their primary care physician. It cannot be going through HealthQuest as typical,
Yes.
unless that is their primary healthcare provider.
Exactly.
Great, thank you. So we have our next question, which is, what are the transportation protocols for athletic teams? And the transportation protocols for athletic teams are actually the same as the transportation protocols for regular school day transportation. So it is a seat on the bus, 1 person per seat, unless those riders live in the same household. So if they're residents of the same household, they may ride together. Otherwise, it's 1 occupant per seat, and we have up to 22 occupants on a bus. And that is with mask. They have to wear their mask, and also with some windows open to circulate fresh air. These are some questions that relate to remote schooling when your child may or actually may not be COVID related absent. If remote schooling is still being offered and we are signed up and are approved for in-person schooling 5 days, and we have a child that for whatever reason, not COVID related, needs to be home for the day, would there be an option to remote in for that day? So actually, it doesn't matter if your child is absent for a COVID reason or not. If they are able to safely isolate or quarantine, whatever is required of them, and can still participate, they're feeling up to participating and have the ability to do that in a way that is safe for your family, then they absolutely would be able to remote in for that day. I would recommend that you're in contact with your child's school, however, so that they know to expect them remoting in that day, and that the teacher can prepare for that if anything else needs to be shared with them in their remote participation. So if an exposed high school student has elementary aged siblings, will those elementary aged siblings be required to quarantine? Maureen, do you want to take that?
Sure. So following the guidance from the DCBH, the contacts of any confirmed positive cases, or in this hypothetical, they were referred to as exposed. So they are also considered contacts or close contacts. So following that guidance, any confirmed positive cases are required to quarantine for 10 days from their last contact. A quarantined individual is required to stay in separate quarters, eat separately, and to eat separately and remain separate from any other members in the household. I'm sorry, I lost my question for a second. So, the elementary age. Okay, so if you are able to keep your student in quarantine, then your exposed student in quarantine. The other siblings, as long as they remain distant from them, don't eat with them, don't share the same bathroom, aren't hanging out with them, then those students are still allowed to come to school. They're permitted to return to school as long as they have no contact with the exposed high school student. If your living arrangements do not afford you the ability to keep everyone separate, then the younger students would be required to quarantine as well. So if the quarantine student becomes symptomatic at any time, then the game will change. It switches over. So if that high school student started as exposed and is separate from its younger siblings, the siblings are permitted to go to school. If at any point in time that exposed high school student in quarantine, separate from its family, has any symptoms whatsoever, they change over from the quarantine category to the isolation category. Hence, their siblings go from being a contact of a contact to being a contact. So back to that ABC slide, if that was helpful to anyone before. Once someone in quarantine has any symptoms whatsoever, the game changes for them and they go into an isolation period or an isolation situation. And then the siblings move into quarantine. And really, I don't want to sound like a broken record, but I please encourage you to contact your school nurse for any further guidance, especially if you have multiple age children and one may be exposed and the others may not, and they'll certainly guide you in permission to come to school or not if they're in a quarantine or an isolation. So if there's any questions whatsoever, please contact your school nurse. But I just want to reiterate, I think the real key there, if you don't have any positives in your house, but you have someone who's been exposed, the key is really to honestly evaluate your living environment. If you can keep your high schooler at this point completely separate from your other children can remain coming to school. If there's any interaction, if there's sharing of a bedroom or sharing meal time at all, then everyone should remain home for the quarantine period.
Thank you for that, Maureen. So I see that we have questions in the chat. Brian, are any of those questions able to be answered at this time?
Yes, so you answered the one. Amy Woods asked about the elementary siblings, so that's been answered. And just to be clear, additionally clear, it was not about just staying home if you have siblings of middle school and high school kids, but if it was contacts, right? But then she additionally asks, what about quarantining if the entire family has already had the virus within the past 90 days and also completed the proper quarantine and has been symptom-free for over a month?
Yes, so if you have tested positive for COVID-19 in the last 90 days, there would be no need to quarantine unless you yourself have newly presenting symptoms. So that's something to keep in mind. And then you would have to contact your healthcare provider. And was there a second part to that? I apologize.
Nope, you and Maureen already covered it.
Okay, great. Laura, did you have anything additional that you'd like to share with our participants?
Nope, not at this time. You're doing great. Thank you.
So again, just to be clear, we will be capturing any questions that come in the Q&A that we're unable to answer at this time. We do see that there are some comments and we are acknowledging them. So thank you for those. There were additionally some comments that were sent in today on the form, and we are taking all of that information back as we continue in our practices and our protocols for safety here at the school district. And additionally, just a reminder, we do have our board meeting on the 9th where we will be discussing the possible expansion of in-person learning and some other information related to that effort. So if you have any interest in that, please feel free to tune in to the board meeting on the 9th.
I do want to thank the nurses and Caroline for spearheading this Q&A. I hope you found it informative. And again, please send in your questions and we will answer them as speedily and as accurately as we can.
Yeah, specifically any case specific questions, it's best to contact the school nurse so that they can get all of the information and give you an accurate picture of quarantine need or anything like that.
There are a couple of other questions coming in. One was inadvertently posted in the chat instead of the Q&A, but we have it. So by your definition, it's this is posed as a statement, but I think it's a question. The entire MHS is classified as a contact of a case since all in-person learning and sports have been suspended until 3/11. Oh, it is a question. There we go. See the question mark.
No, I would not say that that is true. But the effort is actually to prevent further spread of the virus for those that may be carrying the virus and currently asymptomatic, but still able to shed the virus and spread it on to others. So this is actually a mitigation response where we are attempting to slow the spread, if not halt the spread if possible, by not returning to in-person learning until the 11th.
We have another question here. At this point, do you still anticipate fall 2 sports to start March 11th?
So the Board of Education has local governance over that decision, and that is not something that we have the authority to discuss at this time.
And there's a question, do you believe this is a spread via in-person school?
So that's hard to say. If you were in attendance earlier on this evening, I did mention that there are several origins, multiple origins that we are actually tracing at this point. Some of these folks are not in person, and some of this is community spread within our actual larger community that impacts the school district. So that's not necessarily true that it is all spread by in-person learning. And something to be clear, you know, infection doesn't just happen during the school day, and it doesn't just happen, you know, via participation in athletics. There are some activities outside of school that may also have helped with the spread as well. So we need to be cognizant of that. And one of the things that we are really reinforcing is that we need to positively influence each other. And this is really a call to our adolescents to influence each other to make good decisions in helping to mitigate the spread of this virus.
I would just like to be clear back, like a question where they were posing that everyone in the school at this point was considered a contact. You are not, or your child is not considered a contact of a positive person unless you have been contacted, overusing the word, but unless you have been contacted either by the district or through the Department of Health, or possibly if your student and another student participate in an outside organization together, you may have heard from them. But if you have not heard from the Department of Health or the district, then your child is not considered a contact.
Correct. And this, again, is just an effort at mitigation to be able to prevent further spread from asymptomatic carriers at this point.
We have another question. Have any of these positives been tested for the variants that are highly contagious?
I'm unaware of anything specific to that.
And if we are testing our athletes, why can't they practice?
We have not tested our athletes. So again, phase 1 of our testing protocol was due to begin on March 1st. And with that, we would have been able to start phase 1 of our testing protocol, but we were actually fully remote at that time. Additionally, we would like to note that the second phase of that was to be surveillance testing of the wider school community, and that wasn't able to happen either. One thing that we need to be clear about is, as it can take 7 to 14 days for a contact to present with symptoms, we are working with that March 11th date to be able to allow time for any additional currently asymptomatic persons to show symptoms so that we can be sure that we have been able to stop the spread within our schools. Brian, are there any other questions we'll be able to answer at this time?
One just popped in. I don't understand the question. I gotta give me a second to. Yeah, I don't think we're gonna be able to answer that right now. I'll need clarity on it.
Okay, and again, this is being recorded for review at a later time. And additionally, we are making note of any of the questions that are coming in through the Q&A, so we'll be able to publish those that we are able to answer. We will be able to publish that for the community as well.
There's another question. So why are we subject to no in-person learning and our sports program has been halted if many students have not been in contact with COVID positive individuals? I didn't see this in the DCBH website.
And the reason for that is in consultation with the Dutchess County Department of Community and Behavioral Health. The decision was made to go remote until March 11th. March 11th being that date of 10 to 14 days from the initial exposure.
There's a question here. Why should athletes be the only ones tested, and should teachers not be tested first?
So actually athletes are not intended to be the only ones tested, but their participation in high risk sports, they're just being prioritized as phase 1. And there would be asymptomatic surveillance testing available for the community, our school community as well in phase 2.
And why are we subject to no in-person learning and our sports program has been, oh, sorry, we've been there. Someone wondering if we can start the surveillance testing at Elm and Alden.
We can certainly have continued conversations about that. To be clear, at this point, we do not have any active cases at Elm or Alden. That was something that was asked by building. So just to be clear about that, we actually do not have any active cases at Elm or Alden.
Why are we making students and athletes follow quarantine procedures when they haven't been quarantined?
I'm not sure. I'm not sure what that means. If someone was told to quarantine.
Oh, and I think perhaps it was clarified with why is the whole high school shut down?
Okay, so as we know, there have been multiple students, 16, who have tested positive at this point. We are still waiting for test results on other students additionally. As we know that to be true, this is an effort to mitigate or to slow or stop the spread. If we could stop the spread would be great, but slow the spread by not allowing that in-person instruction, as we currently don't know if someone is asymptomatic and yet carrying the virus and able to shed that, therefore spreading it to others. By having everyone in the school building, that would make that more likely.
I would just like to state as well that everything was done in conjunction with the local Department of Health. And although that there are many guidelines out there with the CDC, with the state, and with our local regulations, each individual circumstance is looked at individually. So as Caroline just stated, there were 16 positives in a relatively tight time frame. So in conjunction with our local Department of Health, all of the decisions made here at Millbrook are very specific to these set of circumstances. So although there's a lot of widespread guidance out there, we're grateful to be working in conjunction with our local Department of Health to look specifically at our details. So sometimes not all of the details can be seen from every seat, but It's definitely coming from the Department of Health.
Brian, are there any other questions we can answer at this time?
I think we're good, and the rest we will be able to post.
Thank you. Laura, any closing comments?
I just want to say thank you all for being here, the panel. And I also want to say that it has the Department of Health, the local Department of Health, our DCBH, has been extremely helpful during this time, even when we were having just a couple here and there, but they've been extremely responsive to our situation now and have been very supportive of their surveillance testing. They feel that it is just another layer of mitigation and super important way to help monitor the health of our school community as well as the greater community. It's almost seen as a service to the community because we're able to see whether there's an increase in COVID rates, and we're able to make important and informed decisions about our instruction, our in-person instruction, our remote instruction, and again, to the greater community. So I just wanted to say thank you to them as well.
Absolutely. And thank you again to our school nurse team who did work today to prepare answers to the questions that came in. And thank you for our panelists for being here and participating tonight.
And our parents, the community for
Yes.
being here. We appreciate your really good questions.
Absolutely. Thank you so much for participating. Have a great night. Thank you.
Thank you, everybody.
Good night, everybody.